Hi everyone, I am Dr. Sasikanth Maddu. I am a senior consultant plastic cosmetic surgeon in Yashoda Hospitals at Somajigoda branch. Today I am going to talk to you about rhinoplasty, that is cosmetic surgery of the nose. So rhinoplasty is essentially the surgery which is used to enhance the appearance of the nose in conjunction with the proportions of the rest of the face. So rhinoplasty is essentially a modification of the 6 parts of your nose: 2 bones, 4 cartilages and the skin. So we modify all these 6 in addition to the skin, 6 parts of the nose in such a way that the nose looks much better in proportion with the rest of the face. So generally we see a lot of different noses, like flat nose or over projected nose or a wide nose or deviated nose because of childhood trauma or a previous trauma, or a different kind of nose. Even if everything is normal, sometimes a nose which is out of proportion to the rest of the face. So we correct all these types of different shapes to a standardized shape in conjunction with the rest of the face. So sometimes we decrease the height of the nose in over projected nose by trimming the dorsal cartilage or septum and the dorsum of the nose, and we modify the lower cartilages, lower lateral cartilage or upper lateral cartilages. We hinge it to the septum. We do a different techniques of modification of those cartilages to improve the appearance of the tip of the nose. Similarly, in flat noses or stub noses, we use cartilage of ribs or ears or the septal cartilage, and we modify that cartilage and we shape the cartilage according to the needs and increase the dorsum increase the height of the nose. And sometimes we nowadays we are going to mash the cartilage into small pieces, and it's called mashed cartilage graft, and we keep it instead of a full thickness a normal rib graft or a solid graft, we use a mashed cartilage graft wrapped up in a small fascia, so that it gives a more smoother and a more malleable appearance to the nose. So in such a way, and sometimes we do osteotomies. What we call osteotomies, we break the nasal bones on either side and to increase the projection of the nose as well as increase the height of the nose. In this way we do a lot of modifications in the nose so as to enhance the appearance of the nose. And yes, why do we give so much importance to this rhinoplasty or cosmetic surgery of the nose? Because the nose is the most prominent part of the face. So in any conversational distance or when we see a face of the person, what we see most commonly is or our first attention goes to the nose of that particular person. So it's normal for any particular person or normal for any person to wish for a good looking nose, because that increases his personal appearance as well as his confidence levels when he interacts with other people, and it increases his self-confidence as well as, and it increases the impression that he creates with the other person with whom he is talking. So it is absolutely normal to have to wish for a good looking nose, and it's absolutely important for any particular person to understand expertise of the surgeon who is performing the nose, because it is very important for the operating surgeon to understand or to have a good knowledge of the anatomy of the nose so that he can perform a surgery of the nose well. Thank you very much.